look at the hepatobiliary and pancreatic system, basically, that's what we're talking about. It's a long word, but basically you're looking at the liver and the pancreas at the same time. So pancreaticobiliary disorders. So you're looking what you call biliary, basically you're talking about the liver, then you have the pancreatico, that is the pancreas. Then biliary, you are referring to the biliary system, those pathway where the bile will pass from. Remember, bile is made in the in the liver, then they come through the left and right ducts, hepatic ducts. Then you have a common hepatic duct. And from the common hepatic duct, usually if you're in a fasted state, that is, you're not eating, most of the bile will be directed to the gallbladder, usually through the cystic duct. And then, of course, when you feed, when somebody is feeding, then the gallbladder contracts, releasing the bile, which will go through the cystic duct into the common bile duct, and finally end up in the duodenum. Yeah, usually that duct joins the duodenum, the common bile duct joins the duodenum together with the pancreatic duct. You join it the second part of the duodenum. Remember, the duodenum, we talk about having 4 parts. There is the first part, the second part, or the descending part. Then we have the third part and the fourth part. So the bile usually will get it to the duodenum in the second part. And remember, bile is important in digestion, especially of fats. So it helps like dissolve the fat for ease of digestion in the duodenum. Yeah, so as in other, so basically that's what we talk about, the liver, the pancreaticobiliary disorders, because you're looking also at the pancreas. We know that. So one, as in many other things, you always have to start with anatomy, be able to understand the anatomy and even the physiology, because then only can you understand the dysfunction that can come in, because the function will be in either the anatomy or even the physiology. So we are looking at the disorders. So you can see the liver there, the anterior view, that is looking from it from the front. You can see there is a right lobe, which is usually larger. Then we have the smaller left lobe. But of course, it's divided into actually 5 lobes. The other 2 lobes on the posterior side of the liver, I will be able to see in the next diagram. And then you can see beneath it, there is a gallbladder, just underneath the right lobe. Then you can see the first of ligaments. So the ligaments usually will join the first of ligament, and other ligaments will form part of the support of the liver. So for example, the first of ligament will connect the liver with the diaphragm and the anterior abdominal wall. So it forms part of the support of the liver, those ligaments. And then, so of course, you see that diagram basically showing the superior part, then you can see the inferior, that cross-like diagram. So, so basically, when you look at that, you can see that cross-like diagram showing basically superior, then inferior, then the right and the left. And then the second part, you're looking at from the inferior part, you're looking at the inferior and posterior part. So you can see the additional 2 lobes. So the main one will be the right lobe, left lobe, but you have also a quadrate lobe, so that you can see the gallbladder will be between the right lobe and there is a quadrate lobe there. And then we have the caudate lobe posteriorly. And then you have there, you see there where we have the triad. We have the bile duct, we have the portal vein, and then we have the hepatic artery. Yeah, so that's an important area to note. Yeah, and then you can see the various impressions. You see, depending on the relations of the liver to the structures around it. For example, you can see there, the right renal impression is where it comes in contact with the right kidney. So it will form a small impression on the liver. You have to look at it grossly. Likewise, with the other area, you can see the gastric impression is where it's coming in contact with the stomach. So it will form that depression, a slight depression. That would be the impression for the gastric, that is the stomach. That is where it will be coming in contact with the stomach. And then Then you can see the right adrenal gland impression. That is where, you remember the adrenal gland is the suprarenal gland, a gland that is found just above the kidneys. So we have right suprarenal gland or right adrenal gland, and it also will come with contact posteriorly with the liver. And you can see that impression, that small impression that it will form because it comes in contact with the liver there. So we move on to, so it's important that we really get to understand anatomy and physiology so that you can be able to even understand the disorders. So in any system, we always start with the anatomy, a bit of physiology, and so when we come to the disorders, it's easy to understand them. So when you look at there, you can see the biliary duct, extra hepatic biliary ducts. Because you can see there the common hepatic duct. You can see those two, that will be right hepatic duct, then the left hepatic duct, and it comes together to form the common hepatic duct. And then common hepatic duct together with the cystic duct form the common bile duct, because the cystic duct is the one that would connect to the gallbladder. And then, of course, you can see the pancreas. Yeah, you can see the pancreas there. You can see the tail of the pancreas, the body, then we have the head of the pancreas, just the one that is coming in contact with the duodenum. And there, of course, you can see the pancreatic duct that will bring the enzymes. Yeah, remember the pancreas is both an endocrine gland and also it is an exocrine and an endocrine gland. Exocrine in the fact that it produces enzymes that will be released through the pancreatic duct into the duodenum for the purposes of digestion. And then, of course, the endocrine part of this pancreas would be the isolates of Langerhans. Those are cells that produce insulin that will be released into the bloodstream directly for function all over the body. That is why the pancreas is both an exocrine gland and an endocrine gland. So you see the connection there. Then you can see the duodenal papillae. You can see the hepatopancreatic ampulla. That basically the common bile duct and the pancreatic duct come together, and then we have the hepatopancreatic ampulla, and so comes to the papilla and now releases its contents into the second part of the duodenum. That is the second part of the duodenum. You can see the interior part of the duodenum. You look at the inside part of the duodenum. And remember, duodenum is basically the first part of the small intestine. So when you look at the inside of the small intestine, there is what we call those circular-like appearance. So it's not smooth in the inside. If you are to look at the inside of the intestine, there's those circular configurations there. Yes, so then we move on to the liver lobule. That is basically looking at it histologically, microscopic anatomy. So of course, and you can see a few things. So when you talk about lobule, you're basically talking of that part. You can see which has there's a central vein. If you look at the expanded part, there, magnified part, you can see the central vein. Yeah, and then you can see the hepatocytes. The hepatocyte basically is the liver cells, and the liver cells will be what will produce the bile, because that is one of the functions of the liver, will be to produce the bile. So you can see the hepatocytes, that is the liver cells, and then you can see the bile canaliculi. So basically these are ducts within the liver itself, the liver substance, that once the bile has been produced, they conduct them. That is, those are the bile canaliculi. And you can see the direction of the bile. Yeah, whereas blood is going towards the central vein, the bile will be coming out towards the periphery. And you can see the bile duct there. So it comes and connects to form the bile ducts, then to common the hepatic ducts, common hepatic duct that is extra now outside the liver. There are ducts within the liver, will be the bile ducts within the liver, and then there is the extrahepatic bile ducts. That is where we have the common hepatic duct, where we have right and left hepatic duct, and then they join, of course, to, so there is those bile canaliculi within the substance of the liver itself. So then you can see out there, sometimes we call it portal triad, because there are three. There's a branch of portal vein, and then there is the bile duct, and then there is a branch of hepatic artery. And you can see the hepatic artery, as we said last time, the liver basically has a dual blood supply. Two. There is the hepatic artery that brings mainly oxygenated blood, and then there is a portal vein that brings mostly deoxygenated blood, but with nutrients, because that the portal vein would be what would drain the stomach, the small and the large intestine, so bringing in the nutrients. So that's what we call portal triad. It consists of the bile duct, a branch of portal vein, and a branch of hepatic artery. So you can see the hepatic artery will bring in oxygenated blood, and then the portal vein or a branch of the portal vein will bring the oxygenated blood. And you see the direction of all that blood. Finally, they mix at the central vein, which is a branch of the hepatic vein. Remember, after the central vein, then you go on to hepatic vein, and the hepatic vein continues to join the inferior vena cava, and of course the blood goes back to the heart. Remember the sinusoids. We talked about sinusoids, which you can always go back and look at it. And then there is hepatic macrophages. They are called Kupffer cells. So basically, remember, macrophages are cells that's supposed to be part of the immunity. They're supposed to fight, foreign materials and so on. And almost in any tissue, we have those macrophages. So in this case, we have also macrophages in the liver. And these are supposed, of course, to fight diseases, bacteria, and so on that comes to the liver, either through the blood or elsewhere. Most of the time will be through the blood. So they are called Kupffer cells. So in the liver, you hear of Kupffer cells, which is basically hepatic macrophages. And then, of course, you can see the blood flow through the liver. We'll use just a diagram showing it. So as I said, the liver has dual blood supply. That is, there's two. It comes from the hepatic artery. Around 25% of the blood will be supplied from the hepatic artery, which is mostly oxygenated blood. And then the portal vein, I think, will produce the other 75% of the blood to the liver, which mostly will be deoxygenated blood, but rich in nutrients. Because as I said, it drains the stomach and also the small and large intestine. And of course, it will go from the portal vein, there will be interlobular vein, and then it will enter the sinusoid. That is where now the blood would have mixed, because that is where also the blood from hepatic artery that is oxygenated will come to the sinusoid. So the blood there will be mixed, the blood from portal vein and hepatic artery. And from there now it goes to the central vein. And from the central vein, there will be blood leaving the liver. That is, it will go to the hepatic vein, then inferior vena cava, goes to the right atrium of that. So that is basically the blood flow in the liver. Then bilirubin. So we have to, and I'm sure probably this one you looked already in physiology, how bile is formed. What happened to bilirubin? What happened to it? Because one bile has been formed, what is their fate? Yeah, so most of the time, bile and so on is formed from hemoglobin from worn out erythrocytes. So red blood cells, once they are worn out or they are aged, they are destroyed within the body. And when it is destroyed, you get the heme, and then you get the globin. And then the globin is what form the amino acids. And then the heme, that is from the worn out. And so the heme will now go into to become, will be what will be the bilirubin. Once it is being taken, that will be what will be taken to the liver. It will be unconjugated. So part of the function of the liver would be to conjugate that bilirubin, because the one that is unconjugated will be not soluble in water, but the one that has been conjugated will be soluble. So the part of the liver work of the liver is to conjugate bilirubin, so that we have conjugated bilirubin. Sometimes we call it direct bilirubin. So if you hear of direct bilirubin, it's going to be conjugated. And then if you talk of indirect bilirubin, you're talking of bilirubin that is unconjugated. So most of the bilirubin will be direct, that is conjugated. And so, of course, after once the bile has been formed, then it will go through the bile ducts that we have mentioned into the intestine. It goes to the second part of the duodenum, and it is used within the duodenum, the small intestine, for digestion. So it goes to the intestine, and then partly it will be excreted in feces as stercobilin. So in fact, that is what will give the stool the color, the normal color that stool has, is because of stercobilin. That is why one of the things that happen, you have what we call obstructive jaundice. So if there is obstruction within the extrahepatic bile ducts, that is after it has come out of the liver, maybe the obstruction in the common bile duct, if you obstruct, if you block that part. So this conjugated bilirubin or direct bilirubin will accumulate in the blood. And so we will have what we call obstructive jaundice. So remember, in that case, now the bile will not be able to reach the small intestine. And so you will have stool, what we call pale stool. So one of the things we ask for a patient who has obstructive jaundice is whether they have, we ask them about the color of their stool. So most of the time it is complete obstruction. The stool will be pale because the stercobilin is not able to reach into stool because it is blocked. It is the bile is not able to reach to the duodenum. Of course, another thing in obstructive jaundice that a patient would have is pruritus. That is, they feel itching all over the body and so on. So if you look at obstructive jaundice, which you'll be able to look as you move on in your clinical years, you will be able to understand why the stool will be pale because there is no stercobilin within feces. And then, of course, you can have what we call enterohepatic circulation. That is basically from entero refers to the small intestine or the intestine. So enterohepatic, that means basically it goes into blood and goes back to the liver. So there is that circulation through the portal vein. So it goes back into the liver, enterohepatic circulation. And from there, it goes into the blood, of course, then it is excreted in urine as urobilinogen. So that will be effect of the bilirubin. Excreted in urine as urobilinogen, excreted in feces as stercobilin. I'm sure probably this you've looked in physiology or not, you will be able to still look at it. But it's important that you understand because it will be able to help you to understand the signs and symptoms that you will see in liver disease. Direction of bile flow, which I'm sure we mentioned even before during anatomy probably. You can see, as I said, we have intrahepatic bile ducts. That is the ducts within the bile calanivula, within the liver substance itself. But once they come out of the liver, we call them extrahepatic bile ducts. So extrahepatic bile duct, we have the right hepatic duct, we have left hepatic duct. So we have bile coming into the hepatic duct. And when come together before the common hepatic duct. And most of us said during the feeding state, when you're not feeding or eating, most of the bile will go to the gallbladder through the cystic duct. So you can see them moving to the gallbladder. Yeah, and then from the gallbladder during feeding, usually the gallbladder will contract and now pushes out bile through the cystic duct. I remember I asked this question, I think I can't remember well, and I remember many people couldn't get it. So it will come from the liver, goes to the gallbladder, then from the gallbladder through the cystic duct into the common bile duct, and from there it will get into the second part of the duodenum. Through, you remember there is a duodenal papilla there, then there is the hepatopancreatic papilla that we talked about. Of course, there will be a sphincter. A sphincter by its nature, you can see there hepatopancreatic sphincter. A sphincter, it just prevents things from getting in when it's not needed. So whenever feeding is not there, that sphincter will close so that the bile doesn't get there, so that it goes and be stored in the gallbladder. Just like we have sphincters in many places, including the upper esophageal sphincter. The lower part of the esophagus also has a sphincter to prevent gastric content from getting into the esophagus. You have also in the anal region, we have the anal sphincters that prevent stool from coming out when they're not in the right appropriate time. So sphincter. So here we have also a sphincter that prevents bile from continually flowing into the duodenum. So that's the purpose generally of sphincters anyway. So you see that is the direction of bile.